Good morning, everybody. Hope you're well. Happy Friday on Friday, March 14th. Welcome to our weekly Friday virtual coffee. Let's have a quick run into our agenda. Um, Going through some updates today. I will be doing that. And then obviously we have on from Berwick Insurance Group, Judy Daniels, our expert here. She's going to go through some stuff on employer plans and the difference between Medicare and kind of just run through some of the opportunities there as well. That's today's Judy's Corner. We're then going to do some training and marketing updates, and Christine will be giving a rundown on some stuff we have for marketing for you guys. And then finally, I'm going to run through those carrier updates. We'll have you out of here by 10 a.m. to start your day. But we do thank you for coming on every Friday here at 9 a.m. One thing I just want to add this morning, if you've got any ideas or any topics you would like us to cover on a Friday, please reach out. Again, if there's certain things that you think might be useful to run through or stuff you're not 100% sure of, we can use that as a topic on a Friday to help you guys grow your business. Okay. Just a few updates here. We are entering the last 2 weeks of OEP almost. As you know, we got changes ahead with some of those SEPs, particularly anything FEMA or weather related. Hopefully by now you're aware that after April 1st, you will not be able to utilize that FEMA or any weather related SEP to enroll folks. The only way they can use that SEP is if they go directly through Medicare.gov as well. Again, activity consistency, I do mention that as well. Obviously, many of you are finalizing some of your time at various different locations. I know places like Smith's and Walmart are finishing up. So if you are finalizing their locations, then have a plan for next quarter, what you want to do as well. Next week, hopefully you're all aware, we are doing our quarterly workshop next week. We're out on the road. We're in about 5 different locations throughout California and of course, Las Vegas. So we are very excited to see you all. We've had a pretty good response for you guys RSVPing and telling us you're going to be at the event. So please just make sure it's in your calendar and you know where they are. And if you haven't registered, please do. I know Christine's going to be bringing up the QR code a bit later on the screen, so you can scan it directly from your phone this morning, and we'll leave that slide up for a few seconds for you. But if you haven't registered, please do. We're going to be running through a ton of different topics next week. So just to give you a little bit of a feel for what that day is going to look like. Obviously, we're providing you guys lunch, and then we're going to run into 3 or 4 different topics. We're going to run through some opportunities with technology next week. Christine's going to do a great presentation on marketing to talk about some of the tools and how you can get the most out of your marketing. And of course, Judy Daniels is going to be with us every single event, and we're excited to have Judy with us and thankful that she's going to be spending the week with us at all the locations. And of course, she will be there to go through a presentation on some of the changes to our dual eligible folk, those folk that have Medicaid or Medi-Cal in California and Medicare. So we're going to be talking about some of those updates as well. So lots of good stuff. And it'll be just great to see you all in person next week. Please, if you haven't registered, please consider coming. I think you'll get a lot out of it, and we're looking forward to seeing you. Okay, Q2 business plan. We're a couple of weeks away, so if you haven't put your plan together, please, if you're not sure what to do, reach out. Talk to us a little bit about what you need, what your plans are. If you haven't put a plan together and you're not sure, we can help you. So reach out to one of us. We're here to support and help you. We want to help with your success in Q2. It's going to be a little different this year because, again, some of those changes, those FEMA changes, obviously are not going to be able to be utilized. So think about things like turning 65 is going to be a huge opportunity. obviously those that are dual eligible, and not forgetting CSNP. I think sometimes we forget about that. I think this is a really good opportunity for Q2. Those folks that have some of those chronic conditions obviously have that SEP to make that one-time change as well. So think about some of the things you're going to do. I know the carriers are really focusing on grassroots. That means getting into the community where you live, where you work, and engaging with some of those places. It could be a senior center, it could be a senior apartment building, maybe a mobile home park, maybe you're going to be helping at a food bank. But many of these places are what we call grassroots marketing. Again, there's other opportunities as well out there. I know some of our carriers like WellCare, are partnering, for example, with the US Legion. So again, opportunities for those folk that maybe have a VA plan or are brand new to Medicare on a, with a VA plan that they want to add a Medicare Advantage only plan without the prescription drugs. Lots of opportunities for Q2. Just to let you know, we're going to be adding a few additional products over the next few weeks. So that's to come information on who the carriers and what the products are. But we're looking at new under 65 carriers, some final expense burial plans, annuity, and much, much more. We've got a new partner we're going to be working with. That's also part of Integrity. So again, you're going to be able to utilize some of these through our Life Center and Medicare Center as well. So that's coming soon. We'll let you know as soon as we finalize those plans, the carriers. More information will be out very, very soon. We mentioned about setting up your Q2 events. Many of the carriers require you to set them up in advance. Some of them you only can do a month at the time. So don't forget, if you leave it to the last minute, if you have a desired location, it might be taken by another agent. So make sure you're on the ball and really picking up some of those locations that you want to be at with the different carriers. I really encourage you to do one type of what I call an informal sales event or kiosk, whether it's a CVS, Walgreens, or maybe even some independent pharmacy. Many of our carriers support these programs. So for example, CVS has at least 6 or 7 carriers now that are supporting that. So you can choose and utilize that carrier of choice. If you're not sure which ones are participating, reach out either to your GA, reach out to one of us, and we can support and help you and guide you in the right direction of where you would like to focus. Last thing, you've probably seen this already, but I know Medicare supplement rates, they are increasing double-digit plus. We've already seen United Healthcare around 14% on average have MedSup increases. I know a couple of you already have reached out to me talking about that. Anthem's already increased theirs for March at over 10%, and others are going to follow. So again, you've got to keep in touch with some of those clients. They're going to get a little concerned if their supplemental plan is increasing by a lot. They're going to want to know what other options they have. Don't forget, you can utilize that birthday rule. It does exist to help clients move from one MedSup plan to another. And of course, that's the only way really at the moment, if they're existing. Obviously, if they're new, they get no underwriting. But if they are existing clients, that birthday rule is there to help and support you, which again is that opportunity. Don't forget though, unfortunately, the Medicare Advantage OEP, that's what it is there to help somebody move from one Medicare Advantage plan to another. I know a lot of you know this, but again, you cannot move from a MedSup to Medicare Advantage during OEP. I've had a couple of agents reach out this week and ask me what they can use. Can they use OEP for this? You cannot jump from Medicare Supplement to Medicare Advantage utilizing OEP as well. So please, just get to know those SEPs. I know Judy went through the United Healthcare enrollment guides on utilizing the different enrollment periods a few weeks ago. And again, that's available for you to utilize. You can either get it on Jarvis. It's a great guide. It kind of covers everything, or you can reach out. And I think Lisa has that to hand out to you. Okay, we're going to move on to Judy's Corner. Welcome, Judy. Thanks for joining us.
Hey, good morning, Neil. Good morning, AMA agents. I'm assuming you can hear me okay?
Perfectly, thank you.
Wonderful, wonderful. Well, again, always love coming on here on Friday mornings with you guys. And I recently gave a presentation at a motor car parts place in LA and helped them to understand how Medicare works. But they were on a high deductible health plan for their group insurance. And I had to give them a lot of cautions with that and educate them, as well as their HR people, because their HR people had no idea. And you'll find that when we live here in California, Southern Nevada, heck, probably anywhere in the United States right now with the economy, most people are still working past 65. You just can't afford to retire at age 65 any longer. And you do have Medicare choices, and people are confused. They don't know if they should get their Medicare, if they shouldn't. And so I'm here today to help you maybe understand enough so that you can also talk to prospects and even talk to HR people about this to help them understand what those choices are. So next slide, Neil. So again, people have many options for their coverage when they're working past 65. They can continue with their employer plan if they're still working for an employer with over 20 employees. If they have an employer that has under 20 employees, they need to get their Medicare, even if they're still able to have their group health insurance plan. They also can continue with their retiree or military plan if it's applicable. This will be for people who aren't working any longer. Now, somebody can leave their group insurance and enroll in Part C, which is a Medicare Advantage plan, and that can include their Part D prescription drug coverage. Or they can leave their group insurance, even though they're still working, and enroll in Original Medicare and a Medicare Supplement plan, as well as a standalone Part D prescription drug plan. Next slide, Neil. So again, should somebody enroll in Medicare or should they stay enrolled in their employer coverage? So again, if somebody has an employer, they're working for an employer that has fewer than 20 employees, Medicare is primary and the employer coverage is secondary. So the employee needs to enroll in Medicare Part A and Part B. Failing to enroll in Medicare will trigger penalties. Now, if it's an employer that has 20 or more employees, that employer coverage is primary and Medicare is secondary. So the member or the employee has a choice to enroll in Medicare or not while they're still employed. Remember, by the way, to mention to the HR person or to the prospect that if they were to leave and take COBRA coverage, COBRA coverage is not creditable. So they will incur a late enrollment penalty for Part B if they have COBRA coverage and a full year goes by without getting their Medicare. In addition to that, if they're on a retiree plan is not considered to be creditable coverage. And if that employer ever does away with the retiree plan, they could also have a late enrollment penalty for their Medicare Part B if a full year goes by without any creditable coverage. And retiree plans and COBRA coverage is not considered creditable because it's not based on current active employment. Next slide, Neil. So Medicare and the HSAs. HSA stands for Health Savings Account eligibility. Now, many individuals are confused at the intersection of health savings accounts and Medicare, and here's why. There's two different federal agencies that have primary responsibility for these programs. One is the Department of Health and Human Services, and they're the ones that take care of Medicare. And then there's the Department of Treasury for the health savings accounts. Each agency issues rules related to its products without consideration of the interaction with the other product. So this leaves a lot of people confused. So I want you to be able to help your clients or your prospects or those HR people out there navigate this confusion so that they can remain in compliance with the health savings account rules and not have tax penalties. Nobody wants a tax penalty with the IRS, and this is what they have to be concerned about. Next slide, Neil. So health savings account eligibility at age 65. So a person can still open an HSA, a health savings account at age 65, or contribute to one at age 65 or later, as long as they meet the health savings account eligibility requirements. Here's what they are. First of all, they're covered under an HSA qualified medical plan, and you'll find that these are high deductible health plans. They're very inexpensive. So a lot of employers are now offering high deductible health plans, and there's always a health savings account attached to that. In addition to that, to be eligible for an HSA account, they also cannot be on someone else's tax returns as a dependent. Okay. Then they also can't have any conflicting coverage, including enrollment in Medicare. Medicare is conflicting coverage for someone who has an HSA account. Now, turning 65 does not, in and of itself, preclude them from remaining HSA eligible as long as there's no other disqualifying coverage like Medicare. Okay. So this is what you have to remember. If they're 65 or older, you know, they're working past 65 and a high deductible health plan with an HSA, take a moment and help them understand what they need to do. Next slide. Here's the impact. And this is very, very important. So enrollment in Medicare is going to impact the health savings account eligibility because Medicare doesn't offer an HSA qualifying option. Remember, there's two different departments of the government that looks at these two and they don't interact. So if somebody has Medicare, even just Medicare Part A, they can't make contributions to their HSA account for any months after they enroll in any part of Medicare. So it doesn't matter if they're only enrolled in Medicare Part A or they're only enrolled in Medicare Part B. As soon as they're enrolled in Medicare A or B, they have to stop contributing to the HSA account. Otherwise, they will incur a penalty from the IRS. So even if they're already covered on an HSA qualifying plan, they have to stop those contributions. Now, they can still use the health savings account. They just can't make additional contributions to it, and neither can the employer. Now, I want to remind everybody that enrollment in Part A is not automatic when they turn 65. Okay, they're only enrolled in Part A automatically if they're age 65 or older and receiving either Social Security benefits or railroad retirement benefits. So if they're not receiving Social Security, they're not going to be automatically enrolled in Part A. Now, they're enrolled in Part A and Part B automatically if they're collecting Social Security or Social Security disability benefits and diagnosed with ALS. So this is why if somebody is drawing their Social Security, but they're still working, maybe it's for financial reasons, right? They're going to automatically get that card. And what they need to do is they need to say, oh, wait a minute, I got my Social Security benefits and I'm still working, but because I'm still working and I have this group health plan, I don't want to pay for Medicare yet. So they need to send that Medicare card back to Medicare in order to do that because Medicare assumes, you guys, that or Social Security assumes that if somebody is drawing their Social Security, they're not working. That they assume that. We know what assumptions result from. So we want to make sure people understand that even if they get that card automatically because they're taking their Social Security before age 65, they can send that Medicare card back and refuse it for now. Okay. Now, next page. So you can still get reimbursed income tax free any qualified medical out-of-pocket expenses that aren't reimbursed by other insurance or other resources. If you have an HSA account, the health savings account is there for that reason, to take care of co-insurances and co-pays and deductibles, and sometimes premiums, if the person has this health savings account with their high deductible health plan. So even if they are working past 65, and because they have their Medicare Part A or Part B or both, they can still use that health savings account. They just can't contribute to it any longer. So they can use these health savings account monies for medical plan deductibles, co-pays and co-insurances, dental and vision expenses, insulin and diabetic supplies, over-the-counter drugs and medicine with a prescription. It can take care of a lot of things that they have expenses for. In addition, they can reimburse certain insurance premiums, including any premiums for Medicare Part B and Part D. So if they've got that $185 amount, because remember, if somebody's working past 65 and they're not drawing the Social Security yet, they're going to get billed for their Medicare on a quarterly basis. That Medicare Part B going to be billed on a quarterly basis. They can use their health savings account to pay for that. They can use their health savings account to pay for a Part D premium if they have one. Now, for Medicare Part C, we know that, for example, in some areas, they can get a Medicare Advantage Plan, HMO, for a 0 monthly premium or a very low monthly premium. If it has a premium, the health savings account money can be used to pay for that. If they have a PPO plan, most of those have a premium to them, they can use that health savings account money to pay for that premium. Some Medicare supplement plans can also have that premium or that health savings account money used. Not all of them, just some of them. So again, you can't contribute to the HSA account, neither can the employer. They can't do matching funds, but you can still use the money that's in those accounts. Next slide, Neil. So again, it can be very, very complicated, but now you've got that key ingredient, knowledge, to be able to help people understand, and especially the HR folks. The HR person for this company that has nationwide outlets, by the way, that I also did some webinars for, had no idea about these tax consequences. So make sure that if you're dealing with somebody who's working past 65 and they're thinking about getting their Medicare and they're not sure what to do, make sure that you're talking to them. Now, again, they can use that HSA account even if they dropped out of the employer group health plan. They can still use that HSA money, and it's loaded usually on a Visa or MasterCard. So definitely they can still use that. Okay, let's look at questions that we might have out there. Wow, we got a lot of questions, Neil.
Yeah, I see that, Lisa. I think Lisa's going to run through them. Good morning, Lisa.
Good morning, Neil and everyone. Okay, let's see. The first question, can you still use SEP for California Buy-in Part A starting April 1st? If so, what reason under SEP?
So can you still use the SEP for the California Buy-in Part A starting April 1st? If so, what reason? So Sam is
referring to, you guys, the California buy-in for Part A. Here's the thing. So when you are looking at people who
don't get free Part A, as we know now, you can get your Medicare savings account or Medicare savings program, I should say, the Medicare savings program, you can apply for that. And if you qualify for the QMB status, it pays for Medicare Part A, and you also have to apply for Medicare Part A. Now, starting January 1st of this year, you can also, if you have supplemental security income, you're going to get this automatically. You're going to get the QMB automatically and your Medicare Part A automatically because QMB is going to pay for it. That's the only time that it's going to be automatic. Okay, so then you've also got to apply for this QMB program through the Medicare Savings Program and Medicare Part A. If you don't get it free of charge and you don't have the supplemental security income, because that's the poorest of the poor that are out there. Now, what Sam's referring to is the SEP. Now, when you're applying for your Part A, you know, you've got to have the general enrollment period for Medicare, which is right now, January 1st to March 31st. There are some extenuating circumstances where you could get beyond the general enrollment period for Medicare. And one of those reasons can be that there is a disaster. Now, you can't use a disaster to roll into a Medicare Advantage plan, but you can use a disaster in some cases to enroll in Medicare for the first time. So it depends on the person, but it's not for Medicare Advantage, you guys. Instead, it is for the Medicare itself. Now, if they qualify for their Part A, Sam, then that's newly eligible. So that's their initial enrollment period that they can use to then get a Medicare Advantage plan. So that's it's not gonna be an SEP, it's gonna be an IEP. And I know that was a long-winded response, but hopefully that made sense.
Correct.
Okay, we have several questions on this. The next one will be, is individual health insurance considered non-credible coverage? Can people delay enrolling in Medicare if they have individual health insurance?
Great question, Esther. And in actuality, if somebody is 65 or older, that makes them eligible for Medicare. As long as they are eligible for Medicare, they cannot enroll into a individual plan, Obamacare plan, Covered California plan, ACA plan. You can't do that. If you're already on one, you need to get your Medicare within a couple of months of turning 65. So you cannot delay enrolling in Medicare if you have individual health insurance because you will incur a late enrollment penalty if you don't do that.
Okay, let's see. The next one is with HSA plan and 6 months before is after AEP for changing their employer plan. Do they need to change that plan more than 6 months ahead?
Well, this is a good question.
Remember
that
that AEP
AEP is only for people who have their Medicare and they want to make a decision based on the next year. Okay. But there's certain things that it has no effect on. It has no effect on Medicare supplement and it has no effect on employer plans. Here's the thing, you can drop out of an employer plan, an employer group health plan, anytime during the year if you're 65 and older because you're Medicare eligible. But a person does need, of course, to look at the fact if they have a dependent on that group health plan. That may be why they need to stay on it. But in regards to that, it has nothing to do with AEP, James. Just has everything to do with when they want to drop out of that employer plan or if they want to drop out of it.
Okay, can Part A be refused?
Part A cannot be refused unless they're not eligible for Medicare Part A free of charge. Now, I have gone online with people who wanted to apply online, and because they weren't eligible for free Part A, it actually said in the Social Security website, you're not eligible for Part A, but you are eligible for Part B. That is erroneous, and it's also been what's being told to people at the Social Security window when they go in person or even on the telephone if they don't qualify for free Part A. Guys, the qualifications for Medicare Part A is the same as it is for Part B. The only difference is it's not free of charge, Medicare Part A. So if somebody does not qualify or has been told that Part A is not something that they're not qualified for, first of all, let the prospect know that that is not correct. They are qualified because they qualified for the Medicare Part B, just that they don't qualify for free Part A, but you can help them apply for the Medicare Savings Program. And if they get approved for the QMB status, that will pay that Medicare Part A premium for them.
Okay, let's see. If a person works for a company with fewer than 20 employees, will they receive a penalty for not signing up, even if they have credible coverage?
They could.
They could. The key here is credible coverage. Most small employer group plans are not credible coverage. Most of them are not credible coverage because some of them are through the ACA marketplace. So just remember that. So it's best for that person to go ahead and get their Medicare.
Okay, next question is, do you know which companies will let you pay premium with HSA account?
Well,
Again, if it's Medicare Advantage plan, then you can pay the premium. If it's a Part D plan, you can pay the premium with that HSA money. Medicare supplements, most of them do not.
All right. Next question, is there a requirement that someone with an HSA who wants to enroll in Part A has to stop making contributions at least 6 months prior to applying? Otherwise, the contributions will be taxable.
yeah, Scott.
Yeah, Scott, excellent question. And this is another key fact to remember, you guys. So if you are working past 65 and you have a health savings account because you have a high deductible health plan and you decide, oh, I want to go ahead and get my Medicare Part A and Part B. Here's the thing. When you apply for Medicare Part A after age 65, because you qualified for free Part A, they will backdate it 6 months prior. So if you've made any contributions to your HSA account during that 6 months, you're automatically getting yourself a tax penalty. So if you know that you want to get your Medicare Part A, wait 6 months. Stop contributing to the HSA account and then plan it out for 6 months from there after you've stopped contributing to the HSA account. Otherwise, those contributions you made during that 6 months that the Part A went retroactive will be taxable and will have a penalty.
Okay, next question is, where can we refer our clients for more information regarding HRA rules?
Well, it's not HRA, it's HSA for health savings accounts. They can go to the IRS website if they want to. And it's www.irs.gov. And they can probably just do a search for HSA and it will give them those rules.
All right. How can someone determine if they can pay the Med Sup premium? Is there a certain criteria?
Again, it's only certain plans within the carriers. So there's a certain alphabet letter of plan where you could pay it, and it's one of the really pared down plans. I'll look that up for you and share it with you guys next Friday. But again, it's because it's not got a lot of coverage to it.
All right. Next question. How can someone, let's see, we got that. What about the implication of the employer plan's drug coverage is deemed not credible? Usually the notification letter is distributed in October, which only gives the affected employee 3 months to apply for Medicare for a 1/1 effective date. Do their HSA contributions become taxable?
Well,
Here's the thing. They can apply for, and great question, Scott. So basically, we know that there are some companies that may have a group health insurance plan that doesn't have drug coverage that's credible, and you're correct. They get those letters out in October, which again only gives that employee 3 months to apply for Medicare for a 1/1 effective date. But here's the thing. You're talking about two different things here, Scott. So Medicare can be applied for at any time, right? So I understand you want to make sure that that person can get their drug coverage. Well, if that letter is distributed in October, and it could be that their drug coverage was deemed that it's not creditable, and it's going to be, let's say, not able well, let's say, yeah, it's going to start at the end of December. Okay, so for January 1st, because sometimes this happens in the middle of the year, Scott. But let's say it was for January 1st. Okay, you don't have to have the worry about the health savings account affecting getting the Medicare Part D. They still need to apply for that Medicare Part D. If they don't have Medicare already, of course, they can't. So they're going to apply for the Medicare, and yes, they may have already done contributions in that prior 6 months, and this is a bit of a sticky wicket. They may have that tax penalty. In this case, they should write a letter to the IRS and ask for them to waive the penalty and the tax, because this is something that the employee had no control over, right? The timing just sucks. So they will become taxable, and there will be a late, excuse me, not a late penalty, but a tax penalty because they made contributions, and the Part A is going to be retroactive for 6 months. Now, what they can do, since Part A can go retroactive, doesn't mean Part B does. Part B will not be retroactive. So just have them sign up for Part B Medicare first, because you can have A or B and get the Part D drug plan. See, I'm already thinking out this out loud. So have them get the Part B only and then get their Part D drug plan, but stop contributing to the HSA account. And then 6 months later, get their Medicare Part A. There you go. See, came up with a solution.
All right. Another question on this. What's the penalty if they don't change the HSA?
That's an excellent question, James. I was not prepared to talk about what the penalty was because I believe it can vary, but here's the thing. I'll look that up for you guys and I'll get that answer for you and share it next Friday.
Great. Let's see. What's the maximum Part A premium for those who don't have enough work credits to qualify for partial or no cost Part A?
So if somebody doesn't have any work hours at all paying into FICA taxes, the maximum that you would pay is $503 a month. Yep, $503 a month. That's quite a bit.
All right. And the next question, this isn't a question, but rather an observation when dealing with clients who have an HSA. Some prospects confuse an FSA with an HSA. They're not the same. The rule of thumb is that FSA is use it or lose it program, and the funds expire each calendar year. An individual with an HSA never loses their contributions, even after they stop working.
This is very true, Scott. And this is why I don't like to use acronyms, because they're more confusing to folks. But FSA stands for Flexible Spending Account. Simply means that you can put money aside during the year that is not taxable because it's after tax money. But it goes in and you can set that aside if you know you're going to have certain expenses for medical or drugs or what have you, or dental or vision. But yes, if you don't use it by the end of that calendar year, you lose it. A health savings account, however, even if you stop working for that company or you don't have that high deductible health plan any longer, you still have that money to spend, even if you leave that employment or retire. By the way, there was one other question that I saw flash up there, and it says that retiree plans, there can be that late enrollment penalty. Yes, indeed. If they don't have their Medicare already and they go to get their Medicare and all that they've had is a retiree plan, they can have a late enrollment penalty because it's not based on current active employment because they're retired.
Okay, I think, is that it, Lisa?
That is it for now.
Wonderful. Thank you so
Well,
much.
thank you all very, very much. It was great talking with you today. Good questions.
Thanks, Judy. Appreciate it. Okay, let's move on. We're going to talk about training and marketing. So I'm going to bring on Christine.
Good morning, everybody. Thank you so much, Judy. Wow, I always learn so much. And I'm not yet retired, nor am I quite old enough to get Medicare, but it scares the heck out of me. So I am very happy to be on these calls on Fridays. Just to start out with, you've seen this slide. Make sure that you are letting your other agent friends know about our virtual coffees on Friday, and please invite them to come. If you need the link or you need me to invite them or anything like that, just reach out to me and I am happy to help. Our March training workshops will be our quarterly agent meetings coming up next week. So if you haven't registered, we will help you do that. And then for the Las Vegas agents, just a reminder, every Monday, Christy Stook has this wonderful program, always changing and keeping you guys up to date with training and information. So Medicare Mondays happen at our MRC in Las Vegas every Monday. Next slide, please. Here's the schedule. Take a picture if you need it. This is just the schedule for our quarterly workshops coming up next week, and this is where we will be. To those who have not yet registered, the QR code on the left is for our agents who are signed up with AMA, and the QR code on the right is an invitation for anybody who is not yet with our agency who would like to attend. Please scan appropriately. If you have already registered, please don't register again. We have your information, and we are counting on seeing you for the event that you have registered for, so there is no need to register more than once. Would appreciate that. You want to take a picture of this slide so that you have this. If you don't have time to take a picture, you don't have your phone out, whatever that is, and you want to register, just email me and I will help you get that done. Couple things. I just did a couple of slides. I am in Berwick and Integrity every week, helping agents find information, find training, customize brochures, find flyers, find thank you cards. There is a plethora of information available from Integrity and Berwick. So this week I am going to highlight for you lead generation opportunities. The link is on the bottom. If you would like me to get it for you, I am happy to download it and send it to you. But all of our agents have access to Berwick. So please go into Berwick Marketing and check out everything that they have available there. Know that there is so much marketing and training information available to you because of your affiliation with us. So this downloadable is, I believe, half a dozen pages, pretty easy, but it's helping you understand the process of generating leads. And you know, you're all in the business of creating relationships. Every successful business is about that. So this is going to help you understand how to do that effectively. Next slide, please. And also there's a number of different, I just pictured one on the left so you could see kind of what that looks like. Integrity has a number of different best practice guides, all extremely useful and with clarity on how to accomplish all of these: direct mail, email, social media, lead gen, SEO, which is search engine optimization. So when people Google you, your business, what comes up, video content, your Google business profile, and webinars. There are best, say this fast 5 times, best practice guides available. I can get those for you. So if you are looking for tips and tricks and ways to get any of this done, email me and I will help you get this guide. And as we show every week, here are all the links to our social media accounts. Please make sure that you follow us on all of these accounts. Someone asked earlier, so I'll share with everybody. Neil posts our Friday virtual coffees on our YouTube channel. So check on Monday if you would like to go back and take pictures and re-listen to all of Judy's instructions on HSA. Feel free to just go to our YouTube channel and re-watch these sessions. If you are still closing out OEP and making sure that you are getting all those appointments in, you need some help, you're doing events, you have had Berwick help you develop some flyers and you are putting them out there. I don't have a distribution network for physical media, but I can help you get anything done for your Say Toy Boat 10 times fast. Thank you, Scott. I can help you get these things done and promote it on our social media channel and help you get those done for your social media. So please reach out if you are finishing up OEP and you need any marketing help from me. I think that's it for me today.
Thanks, Christine. As ever, great information. I love the fact you run through a couple of the things that you're looking at every single week. Just to let you know, there's a ton of stuff out there. Some of it you have access to through the Berwick portal, the Integrity Marketing portal, though you guys obviously don't have access as a partner office. With Integrity, we get additional stuff sent to us every single day, it seems, from Integrity, some of the new stuff that's going on. So there's lots of stuff that we can help you with. We're going to cover more of that on our workshops next week. Okay, let me run through some of these updates. Every week we talk about the technology webinar schedule from Integrity. They do some great little tech tips every single Tuesday, as you can see, every single month here. Some of the stuff they're going to be covering is 5 essential sales tools for Medicare Advantage agents. And all of this is Central Time. That's where they're based, Central out in Texas. So again, all of these times are Central, so just take off 2 hours. Elevate your marketing strategy. Again, automating engaging emails. So that's a new one as well. And then we got essential sales tools again for Medicare Advantage. Oh, that's the same one. But again, if you go onto integrity.com/webinars, it will talk about all the different trainings that are available. They also have an on-demand option as well. I think it's through Vimeo with Integrity. So they have their option for on-demand. That means you can watch them at your convenience as well. Lead Center, again, you've got the option to get some discounted leads. Discount code is on here, saving 20%. And then there's some final expense leads, which are only $175 per lead. Also, Lead Center ensures that our quality leads, they check incoming leads against other sources, and they reject duplicates that never hit Lead Center. They validate customer phone numbers and email addresses with multiple third-party data services, suppressing leads that have recently purchased a policy, capturing or a trusted form to get Junior is one of those trusted online forms that are compliant to make sure they're captured online, and they also optimize these lead sources to prioritize these higher performing types of leads. So if you need to purchase leads, there's a great opportunity directly through Lead Center, which connects to your Medicare Center CRM and quoting tool. Okay, some quick updates here. Again, next week, if you're in Las Vegas, part of NABIB, again, there's a program from the Nevada Treasurer, Mr. Zach Conin. And again, there's some great stuff on Savings Trust Program. Day at the Capitol, if you're part of NABIB for Nevada, again, April 2nd and 3rd. CenterWell trainings, you've got the first of these meet and greets next week at Spring Valley. CenterWell are one of our preferred partners for medical groups. They do a great job. They're a senior primary care only function there. So again, they've got a few things coming up over the next few weeks. Anthemwise do a ton of good training. They do a Medicare Monday in the afternoon, just a quick 4 till 4:30 check-in with Serena and her team. You've got the Nevada DSNP deep dive session as well. That's next week on the 19th. And then again, you've got the next Medicare Monday, the 24th. There is a NABIB of Southern Nevada Medicare Summit coming up as well in a couple of weeks, and March Madness OEP wrap up right at the end of the month. This is from Anthem. UHC next week, again, the selling process training. These are all virtual, as you can see, and then learn to grow your business. What a great topic. That's the Thursday after on the 27th. Don't forget some of these trainings that our carrier partners put on. Yes, they're focused around that carrier, but there are some great topics that are going to help you grow your business. Please be on the watch out for these. Okay, let's move to our friends in California here. Prospect Medical Group, they're doing a ton of stuff, as you can see, throughout California. Lots of different trainings and meet and greets, etc. Talking about the Prospect Medical Group value prop and lots of other stuff, including broker open houses and hospital tours, you name it, it's on here. Alignment Health, again, I've got some virtual trainings. Again, this is for March here and into April. As you can see, all the different dates and opportunities, some CSNP stuff going on. And again, sometimes we forget about those CSNP opportunities. And we are super excited to bring you some of this additional training. I think CSNP is going to be something you can really look at. So again, I know some of our agents are doing some projects on maybe folks that have chronic special needs, diabetes, for example, or heart disease. These are both eligible special needs that will make that client eligible for that SEP to join a chronic special needs plan. These plans generally are a lot richer than regular Medicare Advantage, so it always should be something you should recognize with the client when you're doing that needs analysis. And if they are eligible for a CSNP, it's a great opportunity year round. In-person special election training, again, if you, in a couple of weeks, Alignment are doing a Southern California event in Torrance with on the 27th of March, and then they're doing a couple of coffee and kits. And again, if you look at the verification process, you can see there's a process for each carrier, making sure they have that chronic condition form. Most of them have to be signed by a doctor or their primary doctor or specialist. It's important. And again, as you can see, just make sure you follow that process. You all should receive this email, no matter where you live, for Alignment here. California rate change, I mentioned it earlier. There has been a pretty big hike in California for United Healthcare MedSup. The reality is United has one of the most stable Medicare supplement plans because it's been around, I think, for around 80 years. So again, if you're looking for stability, you're probably going to find a great option here. However, you know, we know there are a number, or there's a plethora of Medicare supplement options. Just make sure you're aware so your clients are not moving with somebody else using the birthday rule. Be open with them, be honest, say, look, there's going to be some disruption and changes here with MedSup. We are expecting a lot of the rates to increase. And again, you'll see that. Sometimes if there's a new plan in town or there's an option, you might see a reduced rate. But again, beware, some of these guys that come in for a few years, come in, build their book, put some great rates down, and then they suddenly hike it by 20 or 30%. So just keep an eye out for the carriers that you work with. Lots of United Healthcare training. Look at these national trainings here as well. Tons, and these are all virtual. So again, have a look over the next couple of weeks. Anything you want to go on, this is available through the Learning Lab on Jarvis. WellCare, again, they've got some in-person events coming up from next week. I'm not going to run through all these. Just read them. If you need to take a screenshot, please do. Again, all this info we know has been sent out depending where you live. Just want to cover it for you. And there's some virtual events as well with WellCare. Okay, for our folks out there, not in our two key or main states, again, we've got some opportunities here as well. There's a bonus opportunity to cross-sell that individual dental and MedSup. So again, kickstart your sales with a Humana individual dental cross-plan bonus. So again, if you sell that with a F, high deductible FG, or high deductible or N, there is a bonus. And again, as you can see how much that is, it's $25 per individual. Again, scans SMLA, got a couple more of these carrying on, duals and LIS and compliance selling next week. And as you can see from Aetna, we've got the disaster change. Don't forget, I know most of our carriers are reaching out to us for that. Again, member retention, some great work by our carrier partners showing some of the member retention that's available and the help and support that they have. And again, disaster changes, senior supplement insurance webinars. Again, Aetna has a great national product Also, benefits checkup, making sure seniors can save money. That's helping our seniors utilize their benefits. Always a good meeting to do. And then, of course, T65, which we spoke about being one of the key components over the next few weeks or months. And then reporting updates to Producer World. Lots of great information from our friends at Aetna. And these are just some of the different SEPs. Jamie Ryan is doing a training. She is the new Medicare supplement guru. She took over Angelo just prior to AEP, who retired. March 20th is next week. So if you're able to attend that, is 1 till 2 p.m. Cigna, again, they're in some of our locations, particularly out there in the East Coast. Lots of trainings and options for you with Cigna. That, I believe, is it. Doesn't look like we got many more questions, so we are going to give you guys a whole 5 minutes back. Please, if you haven't registered, come and see us next week. Not only are you going to hopefully find out some information that is going to be new and opportunistic for you, we're going to be, giving some education on technology, a little bit on dual special needs, or a lot on dual special needs and the changes. Again, that's an opportunity for selling, guys. It's an opportunity in Q2. We want to make sure you're fully informed, but we're going to talk about how you can get that marketing, how you can really focus on helping yourself with your growth plan. Again, we'll talk a little bit about action planning and how we can support that. Lots of cool information next week, and you'll get some lunch. Yes, and unlimited drinks all day. Yes, unlimited coffee, tea, I believe, is available. A lot of people have put a lot of hard work into these events. I do thank everybody involved. I'm really excited about these events as well. And please register if you haven't. I'd love to see you in person next week. Have a wonderful weekend, everybody. Appreciate each and every one of you coming on to our call, and we'll talk soon. Take care.